All right, welcome back to Emergency Medical Responders. This is Chapter 18. We're going to cover geriatric emergencies in this particular chapter. We have a very increased numbers of geriatric population within all of our cities, so we need to be able to understand the differences in their physiology and how they develop and what their particular needs are. This chapter will address those. So let's get started. All right, so geriatric patient. It's a patient who's older than 65 years of age. A geriatric patient is commonly defined by this. The geriatric population in the United States is the fastest growing segment of our society. According to the U.S. Census Bureau, about 13% of the U.S. population, or 40.3 million people, were aged 65 years or older in 2010. The natural aging process results in a decline in the functioning of all body systems, so we need to understand that. Heredity and lifestyle choices also influence the speed at which the decline occurs. Right, so do not prejudge the physical or mental condition of older patients. I have been in several marathons and an Ironman competition in which the participants had, we had one individual that was 94 years of age. He got first in his class because he was the only one in his class. What an incredible gentleman he was. It was an honor to watch him cross the finish line. Even though he finished last, it didn't matter. He was first in his class. So don't prejudge him. Many older patients are still vibrant and very healthy. Because older patients experience health problems more frequently than younger people, most emergency medical services respond to many calls involve geriatric patients. These calls will be less stressful for the patient and for you if you understand how to effectively communicate with older patients. It is essential that you conduct a complete full body examination on all patients. Be especially careful as you examine geriatric patients. Try to keep the spouse, if present, informed of what is happening to alleviate some of his or her anxiety. All right, so sensory changes. Two of the most socializing senses are hearing and sight. Many people experience some loss of hearing as they age, and their ability to see often diminishes as well. Activities such as driving and walking can become more hazardous. Also, impaired vision and confusion can often attribute to mistakes in taking medications. Other conditions such as cataracts or macular degeneration may also develop as well. All right, so patients who are hard of hearing are deaf. Hearing loss is an invisible disability. Often hearing losses are more pronounced in the higher frequencies. A person may be able to hear lower frequencies or lower pitched voices, but cannot hear higher pitched voices. Some older adults require the use of a hearing aid. People with certain inner ear disorders are more prone to poor balance and falls than the general population. Communication with hearing impaired patients can be challenging, but be certain an older patient can hear and understand what you say. So identify yourself and speak slowly and clearly. Do not shout, ask the patient if he, she, or can hear you. Speak very directly into the patient's ear or maintain eye contact for lip readers. If you're still having difficulties communicating, offer paper and pencil, and then use sign language if you know it. All right, so here's some simple signs and phrases. For instance, the top left is sick, the top right is hurt, and the bottom is help. So sick, hurt, and help. Okay, so there's just very, very simple phrases that you can use with someone who's hearing impaired that understands, sign language. Right, so patients that are impaired or blind, we need to look for signs indicating visual impairment during our scene size up, such as eyeglasses, a cane, or a service dog. A visually impaired patient may feel vulnerable during an emergency scene, so tell them what's happening. Identify noises and describe the surroundings. Don't sneak up on them, you'll scare them, Find out the patient's name and use it constantly. Provide whatever emotional support that you can provide, and make sure to keep eyeglasses with the patient if possible. All right, so techniques for communicating with older patients. Number one, identify yourself. You always have to identify yourself with any patient. Hi, my name is Jeff. I'm a paramedic. I'm here to help you. Do you need my assistance? Do I have permission to help you? Look directly at the patient. Speak slowly and distinctly. Explain what you're doing and do it in a very simple, clear language. Don't get all medical terminology on them because they don't like that and it doesn't work. And listen to them. Be an active listener. Look at them in the eyes and acknowledge what they're saying. Actively debate back and forth with them and discuss whatever their problems are. Show respect. They've earned it. You don't show respect, somebody's going to come get you for that, right? So make sure you show the respect that they're deserving at their older age. They may be kind of cranky and tired and a little bit on the mean side, but hey, that's okay. They've earned it. You know, they've earned those years. So do respect that and do the best you can to help them out. Don't talk about the patient in front of the patient, period. I mean, they will be very upset with that and may misconstrue it as something negative. And be patient with them. You know, give them time to respond. Right, so muscular and mobility issues. As we get older, several changes occur in our musculoskeletal system. Muscles lose strength. The discs between the vertebrae become narrow, which can cause a lot of loss of height, curvature of the spine, and loss of flexibility. Bones and skeletal system also lose strength as well. You know, they begin to weaken. And it all depends on how sedentary our lifestyle is. If we work out and we swim, and swimming's a good thing, you should stretch every single morning. It'll make you feel good. It'll start your day out right. And then if you can walk, at least keep moving. Always keep moving. And then, of course, older people can experience some loss of balance, so they may be a risk of a fall. These changes overall result in an increased incidence of falls, like I just said, in older patients, and they increase their risk for brain injuries and other injuries, you know, musculoskeletal type of injuries. Right, so slowed movement. As a person ages, movements become slower. You know, they need a little bit more time. They could, use a helping hand or a supporting arm. So give them more time. You know, don't push them. Don't try to rush them, because that's going to end up creating, some anxiety on their end to the point where you may not be able to treat them appropriately. So be careful with that. Fractures. Fractures often occur with geriatric population. It's usually because of osteoporosis. Wrist, spine, hip are very particularly uncommon and also another fact too is that the geriatric population, because of what we call generalized neuropathy, where their nerves don't work so well anymore, they can have a reduced awareness of pain, so they may not even recognize that they have a fracture. Right, so hip fractures are a common result of osteoporosis. They fall. It occurs most frequently in older women. Usually the injured leg is identified through a shortening in relationship to the other leg. The toes of the injured leg are externally rotated, and the injured leg is also shorter than the uninjured. Splint the patient and transport them properly. When I talk about splinting, we're splinting them to a hard surface so we can move them, whether it be a backboard or a scoop stretcher, that kind of thing. All right, so this is table 18-1 out of your book. This is slide 17 of 55. Conditions that may occur with age: hearing loss, impairment, sight, loss of sensation, slow physical fractures, senility, loss of bowel or bladder control. Medical considerations for elderly people. For elderly people, they're generally less able to fight off diseases. Their immune system is not so good as it used to be. It's less effective. They may not be able to cough effectively, so they can expound, product out of their mouth so it doesn't get down into their lungs. They also may have an increased difficulty in handling those secretions overall. Cardiovascular disease, that's the unfortunate part. As we get older, based on our nutrition, those kind of things, we get fatty deposits within inside of our blood vessels. This is called plaque. And these plaque builds up in there. It narrows the arteries, and it causes a hard time for blood to flow through those vessels. These changes increase the occurrence of heart attacks, angina, and also congestive heart failure. Strokes and abdominal aortic aneurysms go along with this. They're two common conditions related to problems with those blood vessels. Geriatric patients may not have the classic signs and symptoms. As you remember, older patients decrease awareness and sensation of pain because of that neuropathy that we were talking about earlier. So treat older patients with a higher degree of suspicion. That's that spidey sense that you got in your brain, that's like, they don't look so good. I think that you need to go to the hospital. So always trust your gut. If your gut's telling you that they should go to the hospital, believe it. Believe it and convince these folks to go to the hospital to be seen. Respiratory diseases, as a person ages, the alveoli lose some of their elasticity and the muscles associated with respirations become weaker, specifically the diaphragm. Two major types of respiratory diseases, which are chronic respiratory diseases and acute respiratory diseases. Right, so patients with chronic obstructive pulmonary disease, this is one of those chronic ones, COPD, may live with this condition for many, many years. A cold or other respiratory infection can result in a true emergency for these folks. Acute respiratory diseases strike quickly, such as pneumonia is common in older patients. And any time that a patient has congestion in their lungs in their older patients, they should be seen by a physician. Treatment, carefully examine them, make sure you get a good past medical history. Most of these folks will have it typed up. They're doctors, most of these people have primary care physicians, and they may have all their history and their medications all typed up for you. Make sure to take that with you to the hospital and treat that patient's presenting symptoms. If you have oxygen, and you're trained to use it, make sure that you're using it with your patient with a respiratory problem. Cancer. Cancer can strike any part of the body. I hate cancer. Oh my God. I have so many friends over the years that have had different afflictions of cancer, skin, tongue cancer, lung cancer, cancer that is in the bone. I mean, it's just awful stuff. Patients call for help when complications from cancer result in usually acute pain, shortness of breath, shock, or some other medical condition. With these folks, understand what their cancer is, be empathetic with them, get the information, find out who their oncologist is so that you can get them transported to the hospital and give that information appropriately to the receiving facility. All right, so altered mental status, common causes of decreased responsiveness in older patients is lack of adequate oxygen to the brain, low blood glucose levels, and then hypothermia. So we need to assess these patients and find out which one it is, and then correct it. Okay, correct whatever that problem is, and obviously call for help and make sure that you arrange for prompt transport. Medications. Oh, these folks can sometimes take a lot of medicines. They may see several doctors for different conditions. Some of these medications may interfere with some actions of other medications, and they may cause adverse side effects. Also, sometimes patients don't take their medications as instructed. This is why it's very important to gather all their medicines up, because we, as the EMS, can arrive and look at the bottle of medication, look at when it was prescribed, what date, how many they were supposed to take on a daily basis, and then how many were supplied when it was bought, and count them, and we can determine whether they're compliant with their medicines or not. So it's really important for us to gather all that information up, gather those medications so we can take a look at them. So we need to determine which type of medications. If the patient's being transported, bring the medications to the hospital. Sometimes the folks are a little resistant to that, but it is important. It is very important to take that, because like I said, it's important for us to know at the hospital, if they are compliant with their medicines, because that can contribute to whatever the problem is that they're experiencing. And infections and sepsis. Infectious diseases or illnesses caused by bacteria, viruses, or fungi. They may affect different body systems in different ways. Older people have weakened immune systems because they're very susceptible to what's going on. I know we have, the COVID-19 right now in this particular time in our life, and it's affecting a lot of elderly people with pre-existing conditions. So signs and symptoms vary with infectious conditions, but common signs and symptoms include fever, fatigue, coughing, muscle aches, and diarrhea. Sepsis. Sepsis is when it's gotten beyond just a local infection. It's now systemically. Sepsis is severe, potentially life-threatening, and it's a complication of a infection. This occurs when chemicals are released into the bloodstream as a result of the infection. It triggers what we call an inflammatory response. Most common in older adult patients and people who have weakened in immune systems. It can progress to what we call septic shock and then ultimately death. So if they got a fever, they're sick, they've got nausea, vomiting, diarrhea, let's treat it as sepsis. They need to go to the hospital. Okay, we don't mess around with this stuff because this could be potentially life-threatening. If an older patient shows signs or symptoms, again, he or she should be evaluated by a physician. Again, sepsis is bad stuff. So let's get prompt transport for them. Patients who require long-term care. Many patients have chronic conditions, are now being treated at home, by nurses or family. There's a variety of complex medical devices that may be with them, to include ventilators, oxygen enrichment devices, surgically inserted breathing tubes, and monitors. The best thing is that these patients, if their acuity is higher, if they're being taken care of at a higher level, there usually will be a nurse there with the patient all the time. So when you get to the house as a first responder, there'll be somebody there that's higher trained than you that say, hey, great, you can help me, do this, do that, until the EMS arrives and a transportation decision has been made. Patients with certain heart conditions may have pacemakers or automated defibrillators. Tubes inserted in the patient's arm, neck, or stomach may provide fluids or food, or may be a conduit for when they go for chemotherapy treatment. Catheters may also drain urine from the patient's bladder as well. These patients take a wide variety of medications. Here's some examples. Here's a patient on your left that is on a ventilator. That is a portable ventilator. He's at home, looks like he's wheelchair bound, and he has a ventilator that's attached to a tracheostomy. The tube on your right is a feeding tube. It is a form of gastrostomy tube. It is into the stomach, and it's used probably for feeding this patient more than likely. Those are some of the things that you can see. Again, the patient with the ventilator, there's somebody there, a caregiver, and this patient looks very conscious, so he's going to probably be able to guide you through some of the process depending on how he communicates. And then the patient on the right is conscious, and he'll let you know exactly what that feeding tube's all about. All right, so remember your role as an EMR, assess immediate problem, okay? Take the appropriate steps in providing care. Don't get overwhelmed by all the equipment. Don't get freaked out about it. Question the patient and the caregivers. In most situations, you need to stabilize the patient for only a few minutes until more EMS personnel arrive. Depression, most common psychiatric conditions experienced by older adults. I mean, they're at the, towards the end of their life, and maybe they feel like they haven't accomplished everything that they needed. Maybe they lost a spouse. The rates of depression rise significantly with the loss of that independence. When the key's taken away, the driver's license. It's more common in women than it is in men. Contributing factors: living in a nursing home or living alone. And again, like I mentioned earlier, loss of a spouse or a close friend. Other contributing factors is obviously their declining health, or if they have any chronic health conditions or terminal illnesses. Be alert for these signs and symptoms. If they look sad, they probably are. So let's see if we can't work with that. Let's see if we can't make sure that they get some social services, to be able to help them out. If you observe those signs of depression, bring the attention to the other EMS providers and medical professionals, and we work on that. We try to get them, involved socially with the folks at the hospital or the local community, especially their church if they belong to a church, and see if we can't get them some help. Suicide. Older men have the highest suicide rate of any age group in the United States. Older people choose more lethal means, resulting in more deaths from suicides in this group. Factors that contribute: physical illness, especially terminal ones, loss of a loved one, and yes, alcohol abuse. In the elder age, there is a higher use of alcohol, and even a higher use of abuse of the alcohol. Listen carefully to the patient. Be alert for indications of hopelessness, depressions, or attempts of suicide. In this photograph, it's pretty obvious to me. I mean, this person looks sad. He looks like he's in deep thought. His facial expressions are not ones of happiness. It looks like one of sadness. So if you suspect a patient may be considering suicide, arrange for treatment. You can't just leave these folks. Law enforcement can help you out with this, along with the other EMS responders that are coming. Dementia. It is a pattern of decline in mental function. It is marked by the impairment of memory and may result in decreases in their ability to reason, to have good judgment, to comprehend even simple things like how to cook, how to tie their shoes, how to get dressed, how to brush their teeth. It can also affect their ability to communicate verbally. It's progressive and usually irreversible. It is an irreversible decline in mental function. 20 to 40%, an estimated 20 to 40% of people older than the age of 85 years have some degree of dementia. You have senile dementia, which is a general term used to describe the abnormal decline of mental functioning seen in older patients. Dementia can be caused by different conditions, such as a small stroke, hardening of the arteries, and also heredity. Alzheimer's disease is the most common type of dementia. Alzheimer's disease is a chronic degenerative disorder that attacks the brain and results in impaired memory, behavior, and also thinking. Patients may experience mood swings and feelings that people are plotting against them. That's very common. Patients also may wander at night or an increased risk of falls. In the terminal stages, patients may be unable to walk, lose control of the bowels and bladder, and become unable to swallow. When caring for these kind of patients, speak clearly and use the patient's name. You may have to repeat it several times, and they don't really understand, but make sure you make it clear as much as they need it. Let the patient know what you're doing at each step of the assessment and treatment, and that you're there to help. They may lash out at you. You never know. I've dealt with two different parents that had dementia, to include Alzheimer's disease. And it was very difficult. And you just have to be patient and go with the flow, man. Not that big a deal. Just be kind and be considerate and make sure that you get them the help that they need. When caring for these patients, again, you're going to have to rely on family members. Family members are caregivers. They usually are not by themselves to provide. And notice in this particular case, again, the first responders are down at this elderly person's level. He's taking blood pressure, hands on his leg. He's trying to be comforting at the same time. They've got the elderly person with a blanket, so they have that warmth and comforting. So you need to utilize that kind and caring approach. It'll go a long ways in treating these kind of patients. Hospice. Hospice is a healthcare program that brings together a variety of caregivers. It provides physical, emotional, spiritual, social, and economic care to patients who have terminal illness and are expected to die somewhere within the next 6 months. These programs also can provide pain relief and other supportive care, respite care. They're wonderful, whether it's your local hospital hospice or Vitas hospice or some kind of hospice form that's a private agency. These people do wonderful work, absolutely wonderful work. Pain relief is provided through oral medications, special pain relieving patches, medications placed in the mouth between the gum and cheek, and EMS is usually called when the patient experiences unexpected problems such as shortness of breath. Advanced directives, it's a document that outlines the care that patients want to receive if they're not able to make their own decisions. Everybody should have one of these. I have one of these. If something unexpected happens to me, I want my wishes respected, and that's what advanced directives are. Many people know this by living will, so be sure that you think about that for your future one day. You never know. You never know when something could happen that could incapacitate you. Now in these advanced directives, it may include what's called a do not resuscitate order, a DNR. A DNR order is requested to withhold CPR and other life-saving measures if a person's heart stops or if he or she stops breathing. It is important for you to know the regulations concerning these documents within your state. If you cannot determine whether an advance directive is valid, begin appropriate medical care and leave the questions to the physicians. Elder abuse. Yep, older adults who are physically weak or mentally compromised are at high risk for abuse by a spouse, a family member, or a friend, even a caregiver. So elder abuse, it can happen. It is common in our society, unfortunately. It may be physical, sexual, emotional, and even financial. Signs and symptoms of abuse: bruises, burns, trauma to the genital area, signs of neglect. As you can see here in this photograph here, this should not be common. Now this is a skin tear in combination with a contusion, probably where he may have been pushed down or fallen, hit his head on the carpet. Either way, our elderly shouldn't be at this kind of stage. They shouldn't be falling and having these kind of injuries if they're well taken care of. This may not have been an actual lash out, hit the elderly person. We don't really know the circumstances behind it. It could be as simple as a fall with a skin tear. But either way, it shouldn't be there. It shouldn't happen, especially repetitively. When you see these in multiple places on the person, it leads us to believe that there's a little bit more to it than just a fall or just something that was accidental. All right, so if you suspect abuse, report it to the authorities. And remember, 1-800-96-ABUSE. That's that telephone number I told you about. Many community-based programs assist with this and assist with supporting geriatric patients who need physical assistance, nutritional support, and emotional help. So there are organizations out there, and usually what we do is when we take these patients to the hospital, especially if they live at home, we try to arrange for a social service visit before they are discharged so that we can figure out what we can do to help them. All right, summary: natural aging process. It's gonna happen. It happens. It's been happening since you were born. You're now 17, 18 or older, whatever. It's part of life, man. It's what you do. And as you get older, fractures are more common, okay, because of the loss of bone density. That can also lead to osteoporosis. Common medical concerns to include cardiovascular and respiratory problems. Common causes: altered mental status is a lack of oxygen to the brain, low blood glucose level, and also hypothermia. And finally, do not overlook the signs of mental health problems in older patients. There are 3 types of mental problems frequently seen: depression, suicidal thoughts, and dementia. Let's not let somebody go down that path. Let's help them, every chance we get. Elder abuse: it happens. It can take the form of physical abuse, sexual abuse, emotional abuse, financial abuse, or neglect. All right, folks, you know what you got to do. Assessment time. Go to your JBL Navigate, go to the assessment block for this chapter, and complete it, and then submit it. And remember, 70% or higher. That's what you need. All right, folks. Again, if you have questions, you know how to get in touch with us. Good stuff. Keep it rolling. You're almost there, and we'll see you next time.